Hello and welcome to QOF 400 screencasts. In this episode, we'll be discussing diabetes management template as used by mainly physicians using our test patient. We will go ahead and launch this particular template. As you can see here, you have a reminder about the diagnostic criteria for diagnosing diabetes mellitus as per the World Health Organization criteria of 2006. Once you've gone through this criteria, decided that your patient suffers with diabetes, then you can go ahead and choose the appropriate code for their diagnosis. In this section here, you will have a combined list of both type 1 and type 2 diabetes. However, assuming this person is type 2, then you have a separate section for type 2 diagnostic codes, which would make it much simpler to choose diagnostic code. For example, we'll choose this particular one here. Once you've done that, then you are going to go ahead and add further details. Assuming this person is on insulin for the management of their type 2 diabetes, then you can go ahead and choose that one, and you can enter further details as to, for example, when the insulin was initiated. Again, as you can see, further reminders with regard to the smoking status and the smoking cessation advice, etc., etc. And of course, you need to advise them regarding the retinal screening, which will be established at a national level. Furthermore, in this section here, you are reminded that you need to screen your patients for depression, as should be the case with most, if not all, chronic diseases. Again, you are reminded with the two questions you need to answer. If the answer to both is no, then you can just go ahead and choose that and say no evidence of depression. If, on the other hand, the person has answered yes to either two questions, you can go ahead and use the appropriate tool for further depression assessments, such as the PHQ-9, in which case the score can be entered here, for example, 13, etc., etc. And then retinal screening, although this does not have to be entered manually, it can be if appropriate. Otherwise, it will be picked up automatically by the records as the data is entered into it. Finally, you will have the section where you are reminded of what to prescribe for your patients and whether or not there are any contraindications to these prescribing measures. I hope this was a useful and a quick reminder of the use of diabetes mellitus template as it is advised to be used by GPs. Thank you.